Okay, so I think that takes us then to our panel discussion on placements and work-based learning. Unfortunately, we don't have our Australian colleagues joining us, and we don't have our original moderator, but my colleague, Dr. Brian Maguire, has very kindly stepped into the breach. So I will hand over to Brian to talk to our panelists, Bronwyn Maloney, Ronan O'Loughlin, Carolyn Donoghue, on work-based learning and placements, and what we've learned from the pandemic. Thanks, Brian.
Thanks, Mairead, and thanks, colleagues, and welcome for staying with us. Johnny Mitchell said you don't know what you missed till it's gone. And during the pandemic, one of the things that was gone was some of our placement opportunities. So we wanted to do a quick round of the experience, on the one hand, of a higher education institution, but on the other hand, of the response from the professional bodies. So we kick off with Bronwyn Maloney from UCD, the Director of Quality there. Bronwyn, what top level messages would you have from UCD's experience of placements during the pandemic?
I think the collegiality, and the sharing of learning across the institution, both at faculty, professional, and all staff, the collaboration, I think, between the HEIs in terms of both learning and so on. I would certainly see, in terms of having to flex and adjust, we had to be more flexible, agile in terms of how we deliver teaching and learning. And certainly the use of our teaching and learning unit and our educational technologists were particularly critical in this area.
Thanks, that's great. We'll come back to the university experience later on, maybe. But I'd like to bring in Ronan O'Loughlin now, from the Director of Education and Training and Chartered Accountant Ireland. Ronan, what issues arose in your experience of the accountancy profession during this time?
Well, we would, as an institute, have about nearly 2,000 students joining us each year. And I think the students of 2020 faced a significant challenge. They would have not had the normal onboarding. In fact, the last year probably in university would have been disrupted by the pandemic. They had a virtual onboarding into their firms. They had a virtual education program, which we delivered, and all virtual assessments. Their work experience, in many cases, would have not involved the normal face-to-face client work that they would have done. It's all done electronically. So they were facing significant challenges for what we can see. So the response then is, how do you support that? Obviously, we were in new ground. We've had to take on board additional supports to our students in terms of trying to help deal with mental health challenges, the isolation, the lack of colleagues around in the normal supervision that you'd have, role modeling, and helping people on their journey. So lots of things, and indeed, even at an informal level, one of the HR directors was highlighting to me, the normal conversation that would happen peer to peer in the workplace isn't happening in the normal way. So to me, the pandemic, as was already said, is something we probably all anticipated would be a few months and would be coming out the other end. It has been a long journey, and we're very much learning as we go. We've identified a number of issues, but we wouldn't say we've cracked it. Interestingly, one firm was talking to me about, normally you'll be working with colleagues, so to try to deal with that, they would have a Teams meeting running in the background. So somebody is there if you want to talk to them, and they both are working away. And firms are doing that to try to support it, but it is not the same as being in the same room or being able to walk over to the water cooler and have a chat about issues as you would normally do. So it's a different world with different challenges.
Thanks, Ronan. I think that's a very interesting point there. On the one hand, the priority was very often put during the pandemic in trying to ensure that the discrete professional competences that are achieved in placements were actually achieved. But you've drawn attention there to the sort of wider socialization, professional socialization, that's also part of the work-based learning elements of many occupations. And it also poses a particular question for how you quality assure that. How do you ensure that people have a good socialization experience? You can test whether they have discrete skill sets that are required in the workplace, but the softer stuff is even more challenging. Listen, if the accountancy trainees had challenges during COVID, the nursing trainees had an even bigger one. So our next contributor is Carolyn Donoghue, the Director of Education Policy and Standards from the Nursing and Midwifery Board of Ireland. Carolyn, where do you start?
Yeah, good question. I think for us, the biggest challenge was safety, because our nursing students undergo a program that is 50% academic and 50% clinical placement. So in order to progress, they need to achieve a lot of competencies within clinical placements every single year. So their clinical placements became unattainable because of pure health and safety reasons. So they were sent on a Friday. We're told on Monday you can't go to your placement, and we don't know when you'll ever get back because of the safety issues. COVID wards were popping up left, right, and centre. Their preceptors, which are their supervisors within the placement areas, were off with COVID and COVID-related contacts. So there were all of a sudden nobody was there to supervise the students. The wards, they wanted to reduce activity, reduce exposure, so therefore the last person to be let in the door is a student. So a national decision was taken that actually all students had to leave the clinical area, the supernumerary students, but then we also left the intern students, which are the fourth years, in the clinical area dealing with COVID because they're part of the workforce. So you had two strands of students on two very different journeys. So we established as a regulator a national oversight committee. And as you say, from listening to the earlier talks, it's that leadership piece, it's the collaboration piece and the inclusion. And I think that's how we all got through, because we had representatives from our higher education institutions, we had the Department of Health, we had CPCs who are the supervisors of the students, the directors of nursing from different areas, included them all within an oversight group on a week-by-week basis to look at what was the level of COVID within the areas and what was the health and safety piece. And then looking at alternative placements. And that's where actually some things that can be difficult can be turned into a positive. Within the vaccination centres, then our students became some of the key people in order to provide vaccinations within a safe environment with training. And so then they became part of the solution. So, you know, I think it's one of those things you have to think on your feet a lot. And I think it was through those oversight groups that a lot of the good solutions came forward.
Great, thank you. And can I ask, they obviously help to address the acute problems, if you like, of the current, recent and current ongoing phase of COVID. Are there lessons there about how placements might be organized in the future? Or, because it sounds like, for nursing and indeed for other professions, there's more flexibility in terms of what's counted as, a mandatory set of placements and so on. Is that being fed forward into changes in regulatory procedures or changes in curricula?
Yeah, I know, absolutely. I think what we've seen is that, we've run based on a very traditional model heretofore, and, in individual pockets, people have been quite innovative and have come to us on a case-by-case basis, looking at different opportunities for placements. But I think COVID expedited that. And then at a national level, every single HEI was looking at what are the other opportunities. So we can't go into the traditional areas, but there is good learning to be had in other sectors and with other professionals. So we have been much more lenient in the approach. And if we have a safety piece, which is called the Clinical Learning Environment Audit, and the HEI undertakes that with the clinical partners. So if they undertake the audit and look at ways that students can achieve learning outcomes, we'll go with it. And I'd say that flexibility seems to have worked an awful lot. And a lot of the students and the HEIs have said that there's actually a greater diversity to the learning that's happening now.
Great, thanks, Caroline. If I can cycle back again to Bronwyn for the institutional perspective, that flexibility that Caroline talked about and that adaptability to the changing circumstances that Ronan referred to, that also obviously happened within the institutions. But from a quality officer's point of view, flexibility isn't always the most welcome phrase, because it means diversity, it means divergences, it means something that you have to keep track of, and especially when you're keeping a track across such a wide range of professions and placement activities. Is there anything sort of general arising from the way in which the university, or your university in particular, is approaching placements as a result of the flexibilities we've seen?
From UCD's perspective, we don't have a formal map of programs with placements or work-based elements at the institution level. It's really determined on the basis of majors with placement and work-based modules linked to them. That's managed at both the institutional level and also at the local level at either the program or the school. Our curriculum would be reviewed annually, and that would be in terms of looking at the learning outcomes for both majors and modules. So therefore, obviously, there would have been adjustment around the variance during COVID and that. I can actually give you a case study or an example, I suppose, of where learning outcomes and professional competencies were addressed or were looked at. And that would be in our School of Public Health, Physiotherapy and Health and Sports Science in our physiotherapy department. And it was where there were no placements available, and we had to put in a telehealth placement for students just to ensure that the students were able to obviously complete their stage or their program. And what this particular module or placement did was provided education in the technology and best practice in telehealth, digital healthcare, which included risk management, scope of practice, privacy and data protection. And this was done with remote learning with either real patients under the care of some of our clinical partners. So obviously we would work with them to develop that, and then those who consented to have consultations or treatment sessions recorded or streamed, or else simulated patients were recruited with the appropriate consent. Obviously, this was very labour intensive for the school, which obviously was a challenge. But what it did was it allowed a large number of students to get observational experience in patient assessment and demonstrations and treatments, which they were able then to devise treatments, plans and progressions for patients and for the programme. That was introduced in 2020, and we obviously repeated this in 2021 and moved it out and spread it out further across the various different stages. I think the potential for this kind of modular placement is something that was particularly useful for the students, and it's something that we intend to take forward. I suppose going back to the quality that you mentioned, Brian, I suppose at the end of it, it is very important as part of that in terms of the discussions that would have been held with our professional bodies, obviously within the university, ensuring that the learning outcomes were met and the assessments were adjusted to meet that as well. And obviously going forward, we look to standardise that virtual placement content and ensure that the digital learning resources are both planned and address that.
Thanks, Bram. That's a great concrete example. I'm sure we could go on with more examples from around the disciplines, but our time is running out. You did talk there about some of the challenges of working in the digital environment and digital placements. Laura has put a link there in the chat to a report we've just done on another aspect of the digital learning, which is the e-proctoring. I know that it's something that has been of great interest to including to the accountancy profession. So that's a report, and there's a video presentation on that available as well. So it does. We're just still gleaning really some of the learning from this experience. Some of the professional bodies have in fact published guidelines about how they're adapting. I draw your attention, particularly one that caught our eye over the summer was the work done by Coru, and they have a guidance for the educators on the design and quality assurance of the placements. One of the reasons why it has some more general interest is that, of course, Coru is a multi-professional regulator, and so they have it's a bit more generic than the guidelines that have been produced by some of the individual professions. So detailing approaches to placement planning, what needs to be done prior to placement, happens during placement, post-placement. So it's just an interesting conceptual model that both the professions and indeed the higher education quality side might want to have a look at. Put a link to it maybe in the chat. Our time is up, and I'm not sure, Mairead, did you want me to wrap up, or do you have something else to wrap up?
I have a couple of things to add.
Right. Okay. So yeah, I just then thank the panel members, Ronan, Carolyn, and Bronwyn, and sorry we didn't have more time to open up these topics.
Thanks so much, Brian, and thank you so much to all of the panelists as well for giving your perspective. I suppose there's just a couple of things that remain. Some of you, and thank you very much to Paul O'Leary for pointing out how to correctly access the second survey. So I just want to quickly present what's come through on that particular poll. So I'm just going to present that quickly. So you can see here a variety of comments, actually quite a few comments. We might PDF this and share this with you, but I'll pick out a few. So I see governance and staff overlap, accreditation and approval criteria. So these are areas for further research into 2022 as part of this program infrastructure and HEIs, including QA. I see the Irish Register of Qualifications coming up there. Types of programs of interest in those outside this remit, accreditation or approval criteria, program infrastructure and HEIs and QA placements in HEIs, links to professional bodies, accreditation standards, ensuring recognition internationally. So there's an awful lot there to digest. So I will share that with you. And I see there are also very positive responses to the question as to whether this area is one that you feel merits further exploration. We've got 42 yes and 6 no. So good to see that the yes is outweighing the no there. I know Brian has already mentioned it, but I just want to draw your attention once more to our recent report on e-proctoring. Laura has put the link in the chat, and you'll also access the recording to a talk by Professor Paul Giller, who completed this report on behalf of QQI at that link. So we very much welcome your thoughts or any questions that you have on that. We would also like to hear your thoughts on what we should do with this programme going into 2022 and beyond. We really welcome your feedback as part of 2 surveys, one for professional bodies and one for HEIs. I've stuck those links into the chat. So we'd really like to hear what you would like to hear about in these kinds of events going forward, what kind of reports or reflections you would like to see. We have built considerable momentum with this programme during 2020 with the accreditation principles, and thank you to all of you who have signed up to those principles. We are really finding common ground I don't know whether that's a pun or what kind of wordplay that is, but we would like to build on that momentum in 2022. And as Karina has said, the accreditation principles are still open for you to sign up to. And if you haven't already done so, we would really welcome that. So I think that's about it. Thank you so much to all of our speakers who spoke today. Mary Lyons from Solace, Dr. Lynn Ramsey from the IUA. We had Dr. Klaus Weil from Professions Australia, and to our panelists, Bronwyn Maloney, Carolyn Donoghue and Ronan O'Loughlin, and to Brian Maguire for stepping into the breach to chair that panel as well. And thank you also to Alison Farrell, Dr. Alison Farrell from the National Forum. I'm not sure whether there's anything else to be said, colleagues, if you want to jump in there with anything further I've forgotten. Otherwise, I'll draw this event to a close, and thank you so much for coming along.